Ultimate Health on Joy 99.7 FM.
Joy 99.7 FM.
We're still in the month of love. My guest and I are not in red.
Joy 99.7 FM.
Let me stick with that theme. Take something from Becca and Bisake there, right? Then we come back in-house and we talk about cervical cancer. About 2 weeks ago, I had the oncologist in the studio. We took a break to give an update on cholera. And we're back to cancer for good reasons. They can stay.
Joy 99.7 FM. Joy 99.7. Joy 99.7 FM.
So beautiful, shed your dye on me, made my life so meaningful, shed your dye on me, median come to me baby, I'm a dreaming home, many the son in us, none come see me no be more, we say, order pa, and win a pa.
Joy 99.7 FM. Joy 99.7 FM.
Gave me a reason to let you stay. My life's never been the same since that day. Oh, I will never ever let you go. I will never ever let you go. I will never ever let you go. All the serious I know. And it's just
Joy 99.7 FM.
shed your dye on me. Or people my rewonina. Or him mommy teach you mutenkoa. It's teaching you one or the kumi. Shed your dye on me. 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 Oh, you made me so beautiful. Shed your dye on me. Made my life so meaningful. Shed your dye on me.
Although sweet the shamani moi, and mommy refi me out in
That's my man, Bisake.
Never really thought I could feel this way. Man, but you surprised me. You love me in a special type of way. That man in your way, you can hear. What can me in your joy? Oh, what day me day. What's this? I'm here singing now. What day, Jody, I would die.
Shed your dye on me.
Man, I'm dreaming was a man who would do pamper.
Shed your dye on me.
Joy 99.7 FM.
Too many, I won't go on me way. But what could my shame is that?
Made him a coming in a chewopa. Maybe I say in a chewonsa. Would you see come pity and shemensa? Into your neck, Medana Mada. Oh, mammy,
I did hear whispered somewhere that Becca's she's not gone for good, she's coming back. I totally love this one, huh? I must confess, huh? When I first heard it, on the cereal shemenum, first thing I heard was cereal, and I was wondering what kind of feeding is that?
Special way. Here's a kiss.
Ultimate Health on Joy 99.7 FM. Yeah, listen, every Sunday, 2:05, we come alive by His grace. If it impacts on your health, your well-being, we'll definitely talk about it. I've got Dr. Anita Uswefriye in the studio
It's another OPK classic.
from the International Maritime Hospital. She's a resident oncologist. We're going to be talking about cervical cancer. But let me also once again express my condolences, Dr. Amma Benin of Aima. You laid your mom to rest over the weekend. I know most of the maritime team are out there shedding and safe return to all of you, right? But I've captured Anita in the studio. I've got her all to myself. Anita, you're welcome. Good to have you in the studio.
Me too.
Right. And, we did start something about 2 weeks ago, right? Let me just boost your mic a bit, right? So we started something on the heels of World Cancer Day, which is, I think, was it 2nd or 3rd February?
4th February.
4th, right? And then we brought you in with Dr. Nadoko.
Yes, please.
She's slippery, so she slipped me again. But it's good to have you for us to talk about cervical cancer. Now, for a lot of people, they tend to, if they've been long-term listeners of Ultimate Health, think, Charlie Nortey talks about this thing a lot. But when we look at the statistics, right, after breast cancer, please, table topper, right?
Yes.
Cervical cancer. And when I look at the numbers, about almost 3,000 women diagnosed annually, and we lose, about 1,700, more than half of them every year.
Yes.
I mean, that is crazy.
Yes. And this is even cases that have been recorded.
These are hospital facility-based records.
Because in Ghana, we don't even have that registry. So there are people, who are dying and we don't know. So, per what we have, more than half of them that are diagnosed die.
Mm-hmm.
Yes, so it's of concern.
It's of concern, especially because most of them we are picking up, diagnostically, are also presenting very late.
Most are advanced cases.
So, folks, if you've joined us, Ultimate Health on Joy 99.7 FM, right? We're talking about cervical cancer, the top, especially when it comes to cancer deaths, right?
For females.
Yes.
Right? After breast cancer, cervical
cancer, the top gynecological cancer, and it's wiping our women, our mothers, our sisters, our wives out.
Yes.
Right? And that's why every year I don't miss, whether I'm doing it with the Greater Accra Regional Hospital, Ridge Hospital, Kolebu, or my ladies from Aima, we must talk about it. So sit up straight. We got serious stuff to talk about. So cervical cancer. Let's go back to the basics very quickly. What is it? Who does it affect? And then we can break it down.
Okay, so the cervix basically is the lowermost parts of the uterus, which we all call the womb.
Right.
So when you take a woman's womb, we have the fundus, we have the body. The body is mostly where, when you are pregnant, that's where the baby is.
That's right.
Then we have the lower part. The very lower part is the cervix.
Okay.
So the cervix is like a connection between the womb and the vagina.
Okay.
So it's sitting there, but it's a continuation with the uterus, the womb, just as the lower part of it.
Right.
So because of where it is, obviously it's only in women that can get cervical cancer, because the cervix is an organ, a reproductive organ in women.
Okay.
Now, when you take cervical cancer, it's one of the cancers that is very preventable, highly preventable, based on the risk factors that has been studied.
We can actually prevent this from happening.
Yes.
All right. So I'm gonna hold that in my back pocket, because somewhere along the line, I'm gonna try and actually understand or explain or account for the numbers we are seeing. If this thing is preventable, right? And we're seeing 3,000 women, and we're losing half of them annually.
Yes.
No bend, no curve. But it is highly
preventable.
Yes. Even before we get to treatment or even the word cure, which people love.
Yeah.
Okay, good. Continue, Anita.
Okay, so it's highly preventable based on the risk factors that has been studied over the period.
Okay.
The reason for the whole cervical cancer awareness month, and we keep echoing it because it's one of the cancers that can be prevented.
Okay.
And I'm sure we'll get the ways to prevent it and
Okay.
all that. Yeah.
Right.
Joy.
So if you just joined us,
99.7
yes,
FM.
we're talking about cervical cancer. I know some of you like saying cervical, okay? Where I came from, right? Just down the road, we say cervical cancer, right? Same thing, same seriousness, okay? I've got an oncologist in the studio, and we're going to talk about the signs, symptoms, the fact that we can prevent it, the risk factors that make you more at risk to getting this. We know the numbers are big,
Yes.
right? Depending on where you were, these numbers can win an election, right? So this is serious stuff. Take it seriously. Now, Anita, one of the things I'm also uncomfortable with, the staggering statistic that suggests that less than 3%, okay, when I click, less than 3% of our women are presenting themselves for these opportunities to screen, detect early, and so on and so forth.
Yes.
That's frightening as well.
Yes. So personally, I think it's the awareness, because I've seen a couple of young people, like I've seen people below 30 years, they come in with advanced stages of cervical cancer, and you ask them whether they've heard of it before, and they tell you no.
How?
The only cancer they know for women is breast cancer. And I'm sure it's because of how over the period Pink October has been going on. So it's the same thing with cervical cancer. We don't echo the whole pap smear, which is a screening method to prevent it. We don't echo it enough. And also there's a lot of misconception about pap smear out there.
Yeah.
What the procedure entails.
Okay.
I've met people that tell me that their head is painful, so they are not going to do it.
Right.
They are not comfortable exposing their private part for another woman to take a sample. So all these things has really affected people going in or working into
Though the bulk of
facilities.
gynecologists are men.
Exactly. It's good. That's
Whoa.
a very good point,
Huh?
actually. Yes. So now we are even trying to train midwives to do the pap smear, because people are not comfortable with the men taking the
My
sample.
retired mother was doing this way back with what we would call vinegar or acetic acid, right? They were doing the VIA
Yeah,
way
VIA.
back. And hey, mom, Charlie, they say they are training midwives, so the midwives have done a lot, from circumcision to whatever. But anyway, so we have various levels of screening techniques available.
Yes.
Most of them should I consider reasonably affordable and
Yes.
accessible.
Yes.
But we are still recording low numbers of women, and they are hearing more, and they are more afraid of breast cancer. So they will do their breast self-examination
Exactly.
and all those things, but they are leaving
The
out
service. Yeah.
the cervical cancer screening. Okay, if you haven't heard about it, look, my WhatsApp is 055 11 11 997. Call so I can give you a knock, or my producer Ziggy can come to your house and give you a knock, right, for not knowing about it, whether you are male or female. This is serious business,
Yes.
right? The numbers we are talking about are staggering. And indeed, I find Ghana also flagged for the numbers. When I look at global data, actually,
Is honestly is the publicity. Yes, it's the publicity. People don't talk about cervical cancer enough.
Okay.
Personally, I have colleagues that are also not comfortable even doing pap smear.
Okay.
These are people in the medical field.
Okay.
The reason being that they are not comfortable opening up private parts, and also they are scared of the outcome.
It's such a quick thing.
Seriously, I'm even surprised.
Right?
Yes, it's very quick.
And even with my colleagues at the Greater Accra Regional Hospital, Doris and Co, you've dogged me, so I dogged you back. But the love is there. You know, there are equipments that you can do even with a mobile phone and a software that can give you some visual, inspection of your cervix.
Yes.
Right?
Yes.
And so we want women to present for these things. But let's get into the details. So we talked about irregular, abnormal, dysfunctional growth and multiplying of cells.
Yes.
2 weeks ago.
Yes.
When we
That's
explained
about cancer.
what cancer was. Let's bring it down to the cervix.
Okay.
Right? So
Yes.
what would cause this thing to happen?
Okay, so with the cervical cancer, the commonest cause identified has been HPV, which is human papilloma virus. So with the human papilloma virus, we have those ones that are low risk virus. Then we have those that are high risk.
Okay.
High risk in the sense that their chances of causing abnormality
All right.
at the cervix is higher as compared to the low risk
Okay.
one. Now, when you get an infection or you get infected with HPV virus, commonly it's through sex. Commonly,
Right.
it's through sex. So when I say sex, it's not always about intercourse penetration.
Okay.
It can even be through the contacts.
All
Okay,
right.
during the whole intimacy, just the skin
You don't
to
want
skin
to
contact.
say those ones. Say
Yes,
it.
just the skin to skin contact.
Whether you want to
Cause
use
the
brushwork
exchange of
or
secretion.
what- yeah.
Yes, exchange of secretion
Right.
you can get that transferred to the other person, and also those who do the oral sex.
Okay.
That one too, you can get the HPV infection.
Now you're
as well.
talking.
Yes. Then the penovaginal sex
Okay.
as well. So now when you get the infection, based on your immunity, the body is able to clear it up
Right.
from the system.
So let's slow down a bit, Anita. So
alright.
HPV is quite prevalent.
Yes.
It's swimming around.
Yes.
And predominantly sexually transmitted. So you can get this based on your sexual practices and number of partners.
Yes.
Okay. Right. But we are concerned when it comes to cervical cancer about some particular strains or variants of HPV.
Yeah, which we call the high risk.
Okay. Now, we are also saying somewhere in there that by and large, some of the other strains of HPV, your body, your immune system will deal with them.
Yes.
Okay. All right. Got that.
All right. So, unfortunately, with some people, their immune system is not able to clear it up, or they get infection from the high risk, which is it takes longer for the body to clear it up.
Okay.
So you get infected with maybe the high risk one of them, the commonest, we have the 16 and the 18.
Okay.
You get infected with it, now the body is not able to clear it up, or your immune system is not able to clear it up. So the persistence of that strain in the cervix now causes changes in the genome.
Okay.
Genome is more like a genetic thing, the chromosome, those things.
Right.
The HPV is like a DNA, so it integrates itself into the genome of the cervical cells.
Okay.
Then, so when it does that, now it causes a whole change in the cellular proliferation. So it affects some particular.
So the cells start to misbehave.
Yes, because it produces some genes,
Okay.
which we call them oncogenes. Oncogenes are genes that are able to cause, onco is like cancer.
Yeah.
So they are able to cause the abnormality for
Alright.
the cell to misbehave.
Okay.
So the HPV, after it has integrated into the cervical cell, produces these oncogenes. The common ones we have E6, E7.
Right.
So they affect some tumor suppressor genes in your system.
Okay.
And immediately they affect them. Now they're able to misbehave over there.
Okay.
Yes.
Right. So you have cells of the cervix now doing the wrong things.
Yes.
And essentially out of control. Okay. So if these changes take place, you are suggesting that routine screening can identify whether your cervix is okay, right? And if there are
Yes.
changes, whether these changes are cancerous.
Yes.
Right. And we can
Yes.
pick that up pretty early.
Pretty early, because we have pre-malignant lesions
Okay.
in cervical cancer.
Right.
Which we call the cervical intraepithelial neoplasia. So commonly you hear CIN, CIN.
Right.
CIN 1, CIN 2, CIN 3.
So it hasn't turned into
yes.
cancer
yes,
proper.
They are pre-malignant.
meaning
And
we caught it early.
exactly.
Okay.
So usually that's the whole point of the pap smear.
All right.
Or the HPV test. So when you're able to detect the stage, if assuming you are getting a pre-malignant one, quickly
right.
something can be done, and continuous follow-up
Okay.
could be done.
All right.
Before you get to the latter stage.
Okay. So for the benefit of my listeners, especially the Stubborn Academy, I have lots of listeners who tell me they do their 3 yearly tests and so on and so forth. We'll talk about how often you should check, right? But if I'm fine, right? You and I haven't talked about signs and symptoms yet.
Yes.
But if I'm generally fine, okay, I've had my children, life is okay, I don't have any problem down there, right?
Okay.
What is the benefit of listening to you and presenting myself for somebody to poke around down there?
Okay.
Right? I need this message to go across. I'm listening to you and Nortey. I am fine. I hear of this thing, but it's not close to me. I can't identify with any of the things you're talking about. I'm fine. Why should I present for screening?
Okay, so we have patients that are asymptomatic. Most people with the pre-malignant lesions.
Okay.
I mean, from my practice, most
Okay.
of them tend to be asymptomatic. Asymptomatic
No
means they are
signs
not
or
showing
symptoms.
any symptoms at all.
All right.
Yeah, you go about your activity and you think you are fine.
Okay.
So I would always entreat women that you honestly don't know what is going on there.
Okay.
Mostly, immediately you start seeing the symptoms, the postcoital bleeding, that's it, bleeding after sex.
You don't leave them yet.
All right,
All
okay.
right. So
most of the times, it's
there are
quite
no signs
advanced.
or symptoms.
Yes.
So you should check.
Yes.
Right? So
Yes.
that a qualified professional will give you the green light so that you don't become one of these 2,990 something
Yes.
cases we diagnose annually, at
Yes.
least at facility or hospital level.
Yes.
All right? I hope you're listening to this. Right. So you should check. How often should a woman check?
All right.
Let's say I'm listening to you, I'm 19. I'm worried, I'm concerned. Am I in the target group?
Okay.
Who should be checking at what age,
All right.
and how often should this happen?
Okay, so usually per recommendation
Joy
from age 21,
99.7
Age
regardless
21.
of your sexual activity,
Whether you are active or not.
regardless from 21,
Okay.
you do the pap smear.
Okay.
So you do the pap smear every 3 years till you are 30 years.
Are you emphasizing on the specific? That is the pap smear.
The pap smear, yes. The
You
pap smear.
must do the
yes.
pap smear.
So anyone from 21 to 30 years,
Right.
you do the pap smear.
Okay.
Now, when you are 30 and above, you do the HPV. So you can add the HPV DNA to the pap.
So the HPV is that you are checking whether you've been exposed to
the virus.
The virus.
Yes.
And then the DNA will tell us which of the variants it
The
is.
strain, yes.
Okay. So when you're younger, you're just doing the pap smear, which examines your cervical cells.
Yes.
Right?
Yes.
And it is able to detect if there are abnormal cells.
Yes.
And then further testing will show whether those are cancerous and so on and so forth.
Yes. Whether there's low risk, high risk, all
Okay.
those strains.
Okay, right. Have we exhausted the risk factors, Anita?
No,
Just
no.
go through them and
All
then
right,
we'll come to
so-
signs and symptoms.
All right. So we have the HPV, which is the commonest. Then we have women with multiple sexual partners.
Okay.
We have partners who are promiscuous. You are not, but your partner is just jumping around.
All right.
Then we have high parity.
All that is multiple.
Yes.
The value is the
Yeah.
same.
High parity, those who have given birth to plenty children, especially with multiple partners. With
Okay.
multiple partners.
Why is that a risk factor?
All right. So
Having had several children or births.
yes. So usually we add with multiple partners because the fact that you've had what's it called, high parity, obviously that means the sexual intercourse has also been a lot.
No, parity is
Yes.
the
you've
number of
given birth to a
children.
lot. Yes. Obviously
Okay.
there's been intercourse before each child will come.
Right.
Intercourse before each child comes.
Uh-huh.
Now, assuming all these children, you have it with maybe Kwesi, the other one was with Kojo.
Okay.
The other one. So at the end of the day, each and every day, you are exposing yourself.
So
to
is
the
that
virus.
not a combination of high parity and multiple partners?
So we add the parity with multiple partners in the sense that someone can have multiple sexual partners,
Okay.
which is a risk factor. Fine.
Okay, that's a risk
The-
factor.
yes.
Okay.
Then we have the high parity in the sense that with each pregnancy,
Okay. There's a
should-
higher risk.
yes.
Okay.
Because there's that intercourse before
Okay.
any pregnancy will happen.
All right.
Yes.
So if I've had 6 children with
Yes.
my committed one partner husband, it's still high parity.
Yes.
Okay.
Yes. But
Right.
with
What
one
is high?
partner,
What is a high number of births for
So
the
more
average
than
woman?
3.
More than 3.
Yes.
Okay. All right. I want my listeners to understand. Shortly, I will activate the phone lines. If you just joined us, I'm in the company of Dr. Anita Uswefriye from the International Maritime Hospital in Tema. She's an oncologist, a resident oncologist. We are going through the motions as we do annually. We're talking about cervical cancer of the cervix, right?
Yes.
Our numbers are staggering. We have very high numbers, close to 3,000 annually, and we're losing almost half, in fact, more than half
More
of them
than half.
every year. And when I say losing, I'm not saying they don't come to the clinic. They are dead, gone. All right? So I'm talking about mortality. All right? So this is serious business. If you have any questions, concerns, WhatsApp is 055 1111 997. I'll shortly activate the phone lines. Let's do a bit more classwork. We are live on Facebook, YouTube, and X as well. This is Ultimate Health on Joy 99.7 FM.
Joy 99.7
As part of my workup, I, re-emphasize the statistics and the fact that about a paltry 3 or something percent of our women do regularly. I mean, women we should be seeing. If we take the population of women in the target group, right, with less than or about 3% of them are actually doing these checks to exclude or eliminate the probability that something is happening down there. All right. And even in the ones we are seeing, these are the numbers that we're losing. So please share with us 055 1111 997. I know you've heard me do this a zillion times, but there's a reason why I'm still stuck on this, right? And okay, let me do the phone line. 030-221-6541. 030-221-6541. This is from Ajua. She says, please, if you have had TAHBSO, I think that's the total hysterectomy.
Yes.
Everything has been removed,
Yes.
right?
Yes.
Do you still need routine cervical cancer checkups or pap smear? Okay. So let's explain what that is.
All right.
Right.
Okay. So for TAHBSO, that's total abdominal hysterectomy with bilateral salpingo oophorectomy.
You know why
So the
I
patient
didn't
has
pronounce
removed-
all that? Okay, go ahead.
So the patient has taken out the tubes, the ovary, the uterus.
Okay.
The uterus is what we know as the womb.
Right.
Now, if your hysterectomy was done and whatever, mostly when we do surgery, we send it for pathology.
Okay.
So if it was benign, they didn't see anything
Right.
malignant, okay, then you can decide not to do the screening again.
Okay. Right.
But if there were pre-malignant lesion,
Right.
maybe you've been treated for the sin,
Okay.
the sin 1, sin 2, sin 3,
Right.
all those ones, then you still have to do annual pelvic examination
Okay.
to see, because anything can happen.
All right.
Yes.
Okay. So you may also, I guess, this is also important. You may have everything removed for different reasons.
Yes.
Okay,
yes,
but there's
yes.
still unfinished business. Like Dr. Osofri is saying, if you have that in your history and your provider has told you, despite having all the tubes, the ovaries, and everything totally removed, you may still require follow-up and you may still
Annual
need
pelvic exam every year.
Great stuff. What are the common symptoms? Araba Niza is asking from Abokobi. We'll
Okay.
get there in a sec. All right. I see. I think Dede is typing in Maryland as usual. Dede, let me scroll down so that I don't miss you. How's Trump treating you? She says, for Muslim women and for others with religious and cultural communities, I can sort of understand if they are uncomfortable with a male gynecologist, but for others who will allow a male obstetrician or gynecologist to deliver their babies, what at all is their matter? Okay, Anita will address that. Thanks, Dede. Stay safe out there. Good afternoon, please. Are you supposed to take a vaccine after a pap smear? And we'll talk about those things. You see, this is why I keep on bringing them back. Great questions there. Let me see what else is there. This one says, okay. Nortey, please, what are the common? Okay, that's the signs and symptoms. All right. So Dede is asking, what else? I mean, if you don't have any religious concerns about being looked at down there, what else?
Some also are concerned about the pain.
Okay.
There's this misconception out there that pap smear is painful.
Okay.
the fact that you lie down wide open. So mostly they have to open up the place with a speculum before they take the sample. So that's speculum they insert, the people feel is just an uncomfortable procedure. So because of that, they also are skeptical in going for the screening.
I can assure you, sitting where I sit behind the microphone without a cervix, that the cancer is not a comfortable thing. You'd rather not go there, all right? You'd rather not go there. Okay, so let's come back. We've talked about some of these things. We've addressed this total hysterectomy and all that. But what are the signs and symptoms? Let's say I've never presented for any of these screening, tests. What are things that could alert me that something may be wrong and it may be related to or associated with cervical cancer? It does not mean I have it.
You have it,
but it's known as a sign or symptom of cervical cancer.
So we have people present with postcoital bleed. That is people who bleed. Coital is sex, who bleed after sex.
Bleeding after sex.
Yes.
Should not be the case.
No.
All right.
So people have intercourse and they see a spot of blood. That is something of concern. And if you are not having history of painful sex and you start having pain during your
intercourse.
Yes, what you call dyspareunia.
Right.
If you have that too, it's of concern.
Okay.
Then we have those that present with abnormal bleeding.
Okay.
I've seen people, they are menopausal. They are in their menopause state. Then suddenly
bleeding when you shouldn't be bleeding from there.
Yes.
As my East African friends will say.
They start seeing blood and they ignore it.
Okay.
Yes. Then we have those that have offensive vaginal discharge. Very offensive. In fact, when it comes to cervical cancer, the discharge, it has a peculiar smell,
and by the time
it's very
the
bad.
discharge gets offensive, then it's advanced.
Yes. So anytime you are noticing maybe a dark brown discharge or any discharge that you are not too sure of what is going on, I think you should just present to the hospital for further assessment. Right. Then we have those that are late symptoms. Those who come with a pain, lower abdominal pain, frequent urination, painful urination. Those ones are advanced. Lymphedema, their legs are all swollen legs, back pain. Those ones are advanced. You know that it's advanced.
Be careful.
Yes, it's advanced.
All right. Yes. You don't want to get there.
No.
These are signs and symptoms which a woman must have investigated.
Yes.
Okay. This is not, you are presenting with signs and symptoms, all right? We're talking more today also about screening and preventive methods, right? So let's be clear, right? If you have any of these things, you are presenting with the problem and then it will be investigated and evaluated and you'll be told what it is, right? Okay. Good afternoon. I've had a pap smear and I followed up with the vaccine at Kolebu. I was given 3 shots over some months in 2022. What next should I do to reduce my risk? I'm 36 years old now with 3 kids. Thank you. I don't have a name there. Any comments, quick comments on that? So
usually for the vaccine, studies have shown that the best period that it works best is 9 to 26 years.
That is age?
Yes.
Okay.
But you can still have it from after 26 to 45. After 45, you can't have the vaccine.
Okay.
So I don't know when she had her vaccine.
Right.
But looking at the ages that I've given you, if maybe she had it around 35 years, that's like she's beyond the 26 age group.
Okay.
So personally, I still advise my patient that HPV is 5 years. When you do it, the next time you have to do it is 5 years time.
That's the vaccine.
Yes.
Okay.
No, when you are going to
the screening, sorry.
Yes.
Yeah.
So if you fall in the age group beyond 26, which is not the age group that you get the vaccine working best, although you can still get the vaccine from 26 to 45.
All right. I
still advise that you can once in a while just have a HPV test done.
Okay.
Just forget about it.
All
but
right.
at least because you are not really in the cut.
But you still get some benefit.
Yes, you do.
Now,
you do.
Please
you
just
do.
quickly tag the fact that she says she's done a pap smear and then I guess based on the all clear, she followed up with the vaccine in 2022. She's asking what she should be doing now to further reduce her risk. Is there anything you'd advise her to do?
So I would advise her that once in a while she can just go for an annual pelvic exam, or she can get HPV DNA test done for her. Yeah.
Right. Okay, I'm trying to catch up with the messages. They are flowing, Papa. This one says, Nortey and Doc, I'm almost 52. Recently, I realized that my cervix has become small. I have an infection and inserted some medication into my vagina. I realized the medication came back and not dissolved fully. I got scared, but I find it difficult to push it there. I did my check again in 2018. I haven't done any cervical screening then. Really wanted to do the screening when I get my salary. Actually, I can't put my own finger down there. It's so painful during intercourse. Amma is asking this. So she feels her cervix or the opening there has become small and constricted. Any quick comment on this?
So I would advise her to have it checked up. Now that she's even saying that when she puts her finger there, it's so
painful.
pain. Yes, I would advise
She's
her that
almost
she has
52.
to. Yes. So for the whole screening, it's after 65
Right.
that you stop doing it. If your previous 10 years one has been fine.
Okay.
So 52, she still has to screen. Yes.
Okay.
Yes.
When you say she should see somebody, and we have great, lovely, exceptional reproductive health facilities. Church is there. We have the people across the road at Rabaka Polyclinic. There's a good team there for STIs, but they give a lot of education. We have the Kolebu people. I mean, there's no reason not to go and check if you have problems down there. Okay, it's important. So whilst we read these things out and her responses are specific to the WhatsApp messages, please, if you have any concerns and you haven't sent us a WhatsApp, please, there are places with trained staff, very friendly, that will sort you out. A polyp was removed from my down there when I was going to do a pap smear, and it was found. And I often have discharges. Do I stand a risk? This is from Na. You don't tell me whether you went on to have the pap smear.
Yes, exactly.
But anything
and
you want,
so that we
and
mostly
she's having
need
discharges.
the outcome of the pap smear. Was it normal?
Okay.
Or whether she went ahead even to do the pap smear when the polyp was found.
Okay.
So if it wasn't done, then I'll advise her to go and do the pap smear.
Okay. Hi, this is from Ifwa in Oyarifa. Is the pap smear the most effective way of detecting cervical cancer? Hello, Nortey. Please ask the doctor if there are different types of pap smear tests and which specific test targets HPV. They want us to go into the test. Let me just clear my WhatsApp and then come back. We'll do those details. Okay, she says
done.
after the
So
polyp
she
was
has to go.
removed. Okay,
So she
please
has to go back.
do not wait. Don't sit around. I saw somebody, I guess, understandably saying she's waiting for her salary. You know,
Yeah.
but please, some of these things, let's see how best we can prioritize them. I remember years back, the Holy Child Year group was sponsoring. They helped.
Even we've
Yes,
subsidized.
they
the
helped me
pap and
sponsor some of
HPV
these things.
now.
We'll talk about those before we
Yes.
leave the studio. All right. So please don't sit around waiting till another Sunday or another year when Nortey does Ultimate Health. All right. This is serious business. Okay. What else have I left out? My niece is 19 and scared the screening will affect her virginity. This is a common one we used to hear, that when you have the PAPS smear done, the whole procedure breaks your hymen, and therefore you can't convince a man that you are a virgin. Can you speak to that, please?
So, all right. So usually, from 21, the niece is 19.
19.
19, she can't get the screenings from 21 going.
Okay.
Yes, but she can get the vaccine.
Okay.
The vaccine is from 9 to 26.
Right.
Yes. So mostly, I advise that if the person is 21, then you do the PAP. Then if it's fine, you just get the vaccine.
Are you a candidate for the vaccine if you have had no screening at all?
All right. So for someone like a 9-year-old, 10-year-old, we still give them the vaccine.
You presume,
yes.
yeah.
We
But a
we
19-year-old, I'm
yes,
not saying
but
anything naughty or bad, but I've done this several years ago where the issue of who is a qualified candidate for vaccination, right? Since there's exposure, if you've been exposed to HPV, are you a candidate for vaccination?
You know, as I was saying, the body, the immunity is able to clear the virus.
Okay.
Yes. So usually within 6 to 24 months.
So we need to check.
Yes.
All right.
The body system. So the perception is, the young people, at least 17 years, 18 years, the immune system can clear it up.
Right.
So most of the time, we still go ahead and give them the vaccine. Just that for some people, they open up to you that they've done stuff.
All right.
So now you are laid back. You want to do the screening before you go ahead and give them the vaccine.
All right, great stuff. Ajwa, who had a total hysterectomy, said that there were malignant cells identified, so she still needs further follow-up.
Did show.
Yes, it did.
Oh, okay,
yeah.
Then she has to.
So she had the total hysterectomy, everything removed.
Then she has
and
to
she was
do
asking
the whole
us,
annual thing.
So she has to be checking.
Yes.
Ajwa, thanks for sharing, and keep up the follow-ups. It's very, very important. Okay, for some women, I know, I guess my guest will confirm that when they have it, it's a very aggressive form, and it progresses very, very quickly.
Yes.
Right. So please follow up. Good afternoon, Nortey. By nature, is the doctor saying every woman is at risk, or it depends on the number of children you have? Because I'm scared about what I'm hearing. This is Gabriel Danso, right?
Okay.
A man, right?
Okay.
Right.
So the high priority one, 3 or more. With multiple partners,
Right.
it puts you at risk.
Okay.
But when he says every woman, it's
has a cervix.
I mean, cervix. I started by saying the cervix is lower part of the womb.
Yeah.
So far as you have the cervix, you are at risk,
Okay.
and even the men too.
Yeah. Okay.
The men too can get the HPV.
HPV, yes. That's why I always include the men, because you're getting it from somewhere. All right. And then so you go and do your HPV screening and your partner is, chilling. Right. So please check and make sure, right, what you're exposed to. Good afternoon, Nortey. I want to know from the doc if someone has no womb, is the person at risk? So we're coming back to that again.
Okay.
Anyway, welcome to my home. This is Oye Nafienya. There's some
hers is about the same person who asked about the hysterectomy.
Right.
So what we said about that one is, what I said is, usually if you've had hysterectomy and your pathology report came out that there was benign findings, there was nothing malignant, or you haven't been treated for any pre-malignant issues, then you can have some rest.
Okay.
But if there were pre-malignant lesions or malignant lesions or reports, then you have to do annual pelvic examination or annual follow-up.
All right. Ajwa corrects us and said the pathology was clear. There's no malignant. I think she meant to type that there was not.
Okay.
Or there were not. Right.
Okay.
No malignant cells were found.
Okay.
All right. So what does she still?
But has she been treated for, or has she done a pap smear before, which maybe was there the pre-malignant? Because it could be that someone has already done a pap before.
Okay.
There were pre-malignant lesions.
All right.
Later she developed maybe some fibroid, other things, and her womb was taken out.
Okay. Right.
So we have to be clear on that.
We need to know why the
TH was done.
DSO
What was the
was done.
indication?
What were the indications?
Yes, and has she ever had any pre-malignant issue with the cervix?
Okay. If in doubt, please, Ajwa, you're already in the net. Go to your provider, ask them all the questions you would ask Nortey or Anita, right? And have that checked for you. The phone line is still active, 030-221-6541. I'm talking with Dr. Anita Ewusu-Friye from the International Maritime Hospital in Tema about cervical cancer. Charlie, it's a topper. It's a killer, right? But it is preventable, right? So we're going through the motions, and your questions have been so spot on that we haven't even got into the details of what the screening involves, okay? But I guess for good reason. Here we don't adjourn Parliament. We just come back next Sunday, right? So let me just see. The lady didn't mention the polyp. Hang on. Whether the polyp was tested or not, and what the result was. And what is she waiting for not to follow up? That's the advice we gave her.
Yes.
This from Dede. All right, great stuff. 46 minutes past the hour 2 on Joy 99.7 FM. Okay, now let's look at what we are looking for, right? And how helpful and maybe specific it is in eliminating our chances of having cervical cancer, or identifying it if it is there. Let's talk about the pap smear first. What is it?
Okay, so the pap smear is a liquid cytology test.
Okay.
And it's a screening test.
Okay.
Purposely for cervical cancer.
Right.
So obviously because of
the
the
Papandrew. Yeah. After was it a Greek?
Papaniklu.
Sorry.
It's
It's a Greek or something guy. Yeah. Yeah.
So mostly we go with the pap. You know, it's a long
Short.
word.
Yes.
Yeah.
His name is long. Right.
All right. So usually it's a procedure personally I counsel my patients if I advise you to do the pap.
All right.
So I tell you not to come in when you are menstruating.
All right.
Because it cannot be done.
Okay.
So I advise them that maybe 2 weeks after your first day of your menses,
All
you
right.
count from that, then you come in.
2 weeks after.
Yes,
All right.
because around that time,
2
chances
weeks
that you are
after
menstruating
you
is very
start
low.
to bleed.
Yes.
All right.
2 weeks from your first day of your cycle.
Okay. I know why I'm saying it. After you start to bleed. All right.
All right.
Yeah. Go ahead.
Then I personally also advise patients to avoid sexual intercourse 24 hours prior to the test.
Before you go and do your pap.
Yes, because of inflammatory cells. You know,
Okay.
some intercourse are quite rigorous.
All right.
And you are going to take the sample too from the service. So you don't want anything altering the results.
Okay.
So
avoid sexual activity.
Yes, at least 24 hours.
At least
24 hours. Because
Try.
I feel anybody that wants to go and do pap, you make your mind
All
up
right.
that next week I'm going to do
It's
a
a
pap.
deliberate. It's not accidental.
Yes.
Okay.
Unless maybe you came in a hospital in an emergency, then that came up.
All
But
right.
mostly you walk in that you're going to do pap.
So
and also
I can
those
imagine, honey, not tonight. I'm going to the hospital tomorrow, right? Honey, you must
you
understand.
You
all right?
understand.
Right?
It's for a good cause.
The
You
men must understand.
Yes.
Okay, go ahead.
Then those who insert things in their vagina, at least you avoid maybe 2 days, 3 days prior to the day you are going for the pap.
Okay.
Just not to alter anything.
Okay.
The results.
Right.
So you come in, you lie down in lithotomy position. Mostly the
You like
position
these
that
big words,
no, so I'm coming down. The position that women assume when they are giving birth. Lithotomy.
Oh my goodness. I love this work, eh? Right. So
All
you're
right.
lying on your back?
Yes.
Okay.
On your back.
Legs raised?
No, legs open,
Open.
like you are giving birth.
Okay, right.
That position.
All right. Not raised.
Personally, I let them assume that
great.
position, opened up.
All right.
But because if it's raised, the patient will be uncomfortable.
Okay.
Yes.
All right.
Already there are a lot of misconception out there, so you
Okay.
want them to be as comfortable as much as possible.
Great. Okay.
You clean up the place, then you set a speculum.
Right.
So the speculum is just like it's like opening the place for enough room so that you can take your sample from the service.
So the speculum allows, it's an instrument that allows you to open up.
Yes.
The opening.
Yes.
Right. Okay.
Yes. Then you take the sample. You identify the service.
Okay.
Then you take the sample from the service. So mostly you try to take it from the transformation zone.
Okay.
It's the commonest place where the cancer cells are found.
Okay.
It's a junction.
So that is why you should know, and the person doing it should know where they are taking the sample from.
Yes, exactly.
They are taking a sample of your cells by gently scraping some of the cells off.
It's not like scrape. If you say scrape, someone might think it's just a brush.
You brush and it will give you
Yes,
the same
like
way you take an oral swab.
Exactly.
Thank you.
It's a brush. Then you brush it there.
Delete scraping from your mind, please. Nortey was wrong. All right. Okay.
So usually it has to be done by a trained personnel because your sample can go in and the pathology will say it's inadequate.
Okay.
Or they didn't find anything based on the sample that was brought. So we advise that you go to a place that the person has been trained.
Take a good sample.
Yes.
Okay.
So after it's taken, we sometimes tell you that you might see some spotting or a
after
little
the
discomfort.
procedure.
Yes. Or a little discomfort, pain.
Right.
Yes. Because we try to get enough sample as much as possible. So
are you sparing the cervix with anything during a pap smear?
No.
Okay, so you're just basically doing this.
Yes.
Taking off.
Yes.
Right.
Using the brush.
The brush
to take the sample.
Okay.
Yes.
And then the sample is secured
in a tube.
Right.
Secured and
identified
sent to the pathology
with
your
labels
name
and all that.
Yes.
Okie
then sent for the
After I've done my pap smear, how long does it take for me to get an outcome?
Okay, so it depends on the facility. Yes, some facilities within a week, 2-3 weeks. So it depends.
Will they call me? Do I have to go back?
For our place, we call them.
You call?
Yes, we call them that your result is in. Come for it.
All right.
Sometimes if the patient happen to pass by the hospital, they will
Right.
just pass by and find out if it's ready.
Okay.
Then they pick it up.
Right. Would
and
you
go.
give somebody their results over the phone?
We don't do that.
Okay. Right. I have a caller on the line.
Okay.
All right. Let me just do that. Hello. Good afternoon.
Good afternoon, Nortey.
Yes. Who's this? Oti?
Oti watching from Kenya.
All right. You're welcome. Share with us quickly.
Yeah, thank you. If a lady has done like fibroid operation before, but they have not have a child, you should go for it. They have like
She's had fibroids removed. She's still looking to conceive, right?
Yeah.
Okay. You are asking, should she still go for these screening?
Yeah.
Okay.
So sometimes you say that you have some white issue there, so should you go for it? Or only for the lady?
No. Hang on. Oti, you are going too fast. You brought in white issue. Is it somebody who has had a fibroid removed and has some kind of discharge? Is that what you are saying?
No, white is a lady have white. I don't know.
You're talking about white. Okay. Candidiasis.
Candidiasis, yeah.
Is that it?
This lady has come before, yeah, candidiasis.
She's had it before.
Yeah.
Okay.
We go for it.
All right. Okay. Right, Anita, I don't know whether you got that right, but
not
he
too
says
clear.
if you've had fibroids removed,
Okay.
right?
So the
there's-
womb is there. It was
right.
just a fibroid that
You're
was
still
taken
looking
out.
to conceive.
All right.
And there seems to be some history of STI.
Okay.
Right. He specifies white. Should you still present for this?
All right. So there's been some STI that are actually risk factors. We have gonorrhea, we have chlamydia. So candidiasis is not really in the typical STI group.
Okay.
But the more reason someone even looking to conceive has to do the pap smear. Because if there's any abnormality, you know the sperm have to pass to the cervix up.
Right.
So if there's anything going on,
Yeah.
you don't expect that sperm, that healthy sperm, to be able to get that chance. Or even if they go, obviously, I mean, you won't get that outcome that you want.
Right.
So personally, even those looking for fruit of the womb,
Right.
I even advise that you do that, so that if there's something going on,
Then you know.
we are trying to fish out the things that is causing the delay.
Right.
And if there's a mass sitting on your cervix, how
Right.
can the sperm penetrate and go?
Okay, great. Gabriel Danso still wants to know about women at risk. Does it mean if you are a woman and you haven't given birth, you are still at risk? Yes.
Yes.
Gabriel,
Yes.
stand on your
It's
chair.
not childbirth. Oh.
You
Yes, it's
see
not
why
childbirth.
sometimes I belabor the point and ask you to explain.
Yes,
again.
it's not childbirth. It's not childbirth. Any woman out there from 21 upwards, you have to screen. Yes.
right.
And a woman can be exposed to multiple sexual partners or has a partner who have multiple sexual partners.
Right.
So
Okay.
she has to screen.
Right. So Ajua says she did this. Oh, this is the same Ajua. The total hysterectomy.
Okay.
She's done the pap smear. It was clear, and she's
so she
also
took the
taken
vaccine.
the
Okay.
vaccine as well. Ajua, spot on. All right. All the best. Okay. Nortey, how efficient is this test when the hospital? Where is it? Okay. When the hospital gives you a kit to take the sample and bring it back to them, as against taking the test as discussed by your guest. This is from Karen. Are there home test kits where you take your own sample?
Yes, yes. But personally, I was telling you that we prefer you take it at the transformation zone.
All right.
That's the commonest site for the cervical cancer.
Okay. So let me shorten it this way since we're running out of time. So I've done a home test kit, right? And it gives me an indication, right? If I came to you, you'd still do your tests?
So
you still take your sample?
No, I'll take you through how you did the test.
Okay.
If you describe everything to me and listening to it, I feel okay. That was a good one. Whatever the outcome will be, I'll take it.
Okay.
But if you describe to me how you did it and it doesn't really sound like you went through the thorough thing, then I will just suggest that it's better we do it at the hospital for you.
Okay, Karen, I hope that sorts you out. I have a caller on the line. Hello, good afternoon. Hello.
Yes, I was. Good afternoon.
Yes, go ahead. Go ahead. This is Ajingo. Quickly.
Please, all ladies have risk. What about those ladies who apply some creams in their private parts, for example, like joy ointment? Is it dangerous
to do that.
As for you, Ajingo, I'll come to Tema one of these days. They apply what? Joy ointment.
Something like that.
What is joy ointment? You know all the ladies and what they've been doing. So people who apply stuff down there. All right.
Yes,
Okay. So there hasn't been any clear cut that if you are applying something there, it's a risk factor. But personal opinion, you know, your immune. I spoke about the fact that immune system tries to clear up the HPV.
Make it professional opinion.
Professional opinion.
You are an oncologist
yes,
speaking to
professional
them.
opinion.
Otherwise,
if you are,
Ziggy and I will start giving personal
no,
opinions.
no. So if you are putting something there, whatever it is, now alters the natural environment there.
That's right. Okay.
For you to be able to clear the virus from there. So at the end of the day, you put yourself at risk.
Okay.
Although it's not a clear risk factor, it affects the whole natural environment there.
Yeah.
Yes.
Okay. Understand that. Okay. If you are putting something there, you're already affecting manufacturer settings.
Yes.
All right. Don't do that. And if you're doing that, it's relevant history anyway. We're fast running out of time. Please, how much does the vaccine cost?
Okay, so now there's a we are doing a promo, so it's
So this one you're talking about IMA specifically.
Yes, IMA
okay.
specifically.
Hit that quickly.
All right, so it's around 1,000
For how many shots?
for the 3 shots.
Okay, over
Yes.
what period?
So the 3 shots, you get one. Then your next one is like 2 months after the first one.
Okay.
Then the third one is like 6 months after the first one.
All right.
Yeah.
In total, that will cost you the 1,000.
Yes.
Okay. Can you pay in tots?
No,
Or you pay
please.
once?
Once.
All right. So the 1,000 is the promotional
Yes.
cost.
Yes.
Okay. When it's not during a promotion, how much would that cost?
I think for that it's over 1,000, but I have to find out the exact figure.
Okay.
Yes.
Right. Ziggy is asking, is it dollars?
No, 1,000 Ghana cedis.
Ghana cedis.
Yes.
Okay. Now, let me ask again, perhaps let me stick specific to IMA. Are you also offering VIA, visual screening with?
No, we are doing the PAP with HPV.
Okay.
So the PAP, we've cut down the cost to 200 cedis.
All right.
Then the HPV, we cut down the cost to 385 cedis.
So the pap smear is 200
Ghana cedis.
Ghana cedis, right? And then when you do the HPV testing to check
It's
on,
385 Ghana cedis.
so
the two will be 585
Okay.
Ghana cedis.
right, okay. All right. This is what happens then. I have to fight with Edem for an extra 30 minutes. When it's getting to 3, that's where it's with the speculum place. Do they have a specialized light to see and take the sample with the soft brush?
The light source is a must.
Did they?
Yes, the light source is a must. It's there.
Did they always suspect our people here?
Oh,
But
no.
it's a good question.
Yes, yes. There's
Into
a light
what?
source.
I see how light can you know?
There's a light source. No, so it's like this, your microphone.
Right. So you direct
adjust,
it.
yes.
Okay.
Yes.
All right. That's why the woman is positioned such that
The
everything-
reason I was saying that you listen to the person who went to pick the sample at home
yeah.
to make sure
Because
that
they are not seeing the way a trained person
Yes,
would
exactly.
see.
Yes.
Okay. What are other options available to her? To who? Let me just see. She was asked. Oh, this is a long one. Where did the woman say? Good afternoon, Nortey. I'm AC. 55-year-old friend of mine had vaginal bleeding for over 2 years. She had been in and out of hospital. She had pap smear, which was negative. She was asked to do endometrial biopsy. She did, but was very painful to her, and she was told they couldn't get any sample after all that trauma. What other options are available to her? She's lost a lot of weight.
Okay, so the endometrial sample, mostly from what I know, this is mostly done by the gynecologist.
Yes.
But I know anytime they get
Endometrium is the
inadequate
lining
sample,
of the-
yes,
right.
anytime they don't get inadequate sample, they go back and try to get enough sample. Yes. So with the person losing weight and all, I would advise that they follow up,
Okay.
maybe at a different facility.
Okay, right, great stuff. So we've covered the pap smear, right? If you were doing the VIA, then the cells or the cervix is smeared with
acetic acid.
and then it changes.
to white. Those places with the abnormal
The abnormal cells will
you
change.
See, so mostly we call acid to white.
Right.
Yes.
Okay.
Then you follow up from there. So usually a colposcopy will be done.
Okay.
Then a sample will be taken.
All
and
right,
all that. Yes.
all right. The VIA tends to be cheaper. Oh,
It is, but now a lot of people are pushing for the pap smear and the HPV. You know, because of sometimes you don't know even the person is, if the person is going to react to the acetic acid.
All right.
And also you get to do the HPV test as well when you take the pap. You can add the HPV test as well to be done.
Okay.
Yes. So now, if I hardly now hear people doing the VIA, unless maybe the person can't afford the pap.
All right. It's an issue of accessibility as well. All right. Please, the location of IMAH. It is IMAH, abbreviation for International Maritime Hospital. Location.
Tema. Community 3.
All right. It's a big, lovely place. You can't miss it, as they'll say in the UK. You can't miss it, right? When they don't know the directions, they tell you can't miss it. But you can't miss IMA. No. But you can Google as well.
Yes.
And then there's a gentleman who's been jostling me about, I mentioned something about tea bags and a few things. Please Google. I did say I'll send you, but just Google tea bags, okay? There's a lot of information coming around about tea bags and what they may, certain types may leak into your tea and all that, all right? So that's why he's just in me. Okay, I must remember that, and Ziggy can send me that information. Okay, so we'll see if we can squeeze and get you again. Why are you looking at me in that tone of voice? Me and you, we are married, though, right? But it's important that we explain. Maybe some of your colleagues, they'll be back from Kumasi as well, right? Yes. But we explain the different outcomes, okay, so that we know what we are collating and what we are gazetting. So that people understand, because people sometimes tell us they didn't quite say it. Sometimes they've been told, but they are in denial. So we'll look at the different outcomes and how this will be communicated to the woman,
very, very
and
important.
what the next steps are. All right.
Yes.
When they say it is not cancerous, do you go on holiday?
No.
Do you hire canopies and have a party?
You know, I spoke about the pre-malignant
right, exactly.
ones. Yes,
yeah. So we'll have to have you or maybe another colleague come in to explain that to our women. The traffic on the WhatsApp has been good, but I am still not happy when I look at the statistics. The numbers we are recording, who actually go and follow up and check these things. Ask the doctor if this time it will be painful for me since putting my finger. This is the lady who says, well, that has to be checked. We have to find out.
Yes, what exactly is there causing the pain?
Yes, because when you mentioned it, there could be a mass, there could be anything.
Exactly.
But we are not able to do that over radio.
Amma, please, you have to try and get it checked.
Amma, okay. Yes. Maybe we need to follow up and see if we can do some referral. All right. So we've done 4 minutes past the hour of 3. We're most grateful, Dr. Anita. Today I didn't call you Dr. Anita, right? But this is very, very important. I'm hoping that there'll be a year or a time I do this program and the statistics are so encouraging and inspiring. I know many of you have positive cervical cancer stories to share. Right, so I'll be looking out. I'll follow up with some of the clinics we partner with, right, to get this. And then if you have positive stories as well, we don't need the names, we need the details, right, so that we can inspire people and their partners to check and follow up rather than be in fear and go for praise and worship and laying of hands and all that, okay? Even the Osofos, they go to hospital, right? Many thanks once again, Dr. Anita Osu Afriye. She's with IMA, International Maritime Hospital in Tema, Community 3. She's a resident oncologist there. We've been talking about cervical cancer. Many thanks to you, my discerning listeners as well, all right? All right, okay, right, anyway. We're out of time, and my producer Ziggy is coming back with some good Sunday afternoon music, but it should not cause you to erase all that we discussed from memory, right? These are important things. We are losing precious women, precious lives, and we aim to save lives. Take and stay on Joy 99.7 FM. My name is Nortey. By nature, I'm out. I guess I'll leave you with Becca again, and then Ziggy takes over. And when I'm driving away from the studio, I listen to him. The guy get vibe. He get vibes. Take and stay. Don't go away.